Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of April 17th, 2023. Following a status update on COVID-19, I will talk about the XBB.1.16 variant and the new symptom that seems to be coming with it, as well as a brief overview of the human metapneumovirus. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Taking a look worldwide, I'm sharing this map from Our World in Data, and they derive their worldwide cases from the World Health Organization COVID-19 dashboard. With the loss of so many trackers and the inconsistency of testing in general, I am moving towards reporting on these data, which show the change in cases over time. That way, we're not attempting to compare total cases across different countries, but rather the change in the number of new cases. So it's like we're comparing each country against itself over time. In this case, we are looking at confirmed cases over the past 14 days per country, relative to the number of cases that country had the previous 14 days. Where the warmer colors represent greater increases in cases, we can see that Mongolia and Nepal have more than 400% increases in cases, and India and Libya has more than 200% increases in cases. Here in the United States, we're looking fairly neutral overall, with a slight decrease in cases over the last 14 days. Taking a closer look at the United States, we can see that about 40% of the country is in substantial or high transmission, which is down from last week when we were at about 50%. And we can see that there's quite a bit of variability from county to county and state to state. Arizona is almost all substantial to high transmission, and we can see that the state of Iowa is no longer reporting its data to the CDC at all. The majority of California is experiencing moderate transmission, with a small handful of counties in the low transmission and a few in the substantial range. Taking a look at COVID deaths nationwide so far in 2023, 39,237 people have lost their lives to COVID-19, 3,100 of those for just the first 12 days of April. Deaths have come down slightly these past couple of weeks, just like they have every April since the start of the pandemic. In fact, the lowest weekly number of deaths since the pandemic started was for the week of April 23rd, 2022. So we've posted more deaths every single week since then. Hopefully our death numbers will continue to come down. But of course, as I mentioned, April is always a month with kind of a low. So we would be wise to prepare for summer increases, just like we've seen every summer since the pandemic started. Taking a look at wastewater, this is looking at the nation overall. Still difficult to tell how useful this is going to be, but the shaded area to the far right there shows the past 2 weeks, and the red and orange areas represent testing sites with increases. And those do appear to be ticking up. When we take a look at the map, again, we see a lot of variability. We also see a lot of sites that are not reporting at all. Those are the ones in dark gray. And we also see large geographic increases or geographic areas with no sites reporting at all. So we're definitely hoping that we'll see more sites added over time, but much like the map of community transmission, we can see that there's quite a bit of variability from region to region. Now taking a look at variant proportions. So XBB.1.5, we'll recall, was up close to the 90% range, and we were kind of hoping it would just take over and stay there so that we could be in a more steady state and know what we're dealing with. But now you can see that XBB.1.5 has come down as it's being displaced by other variants. XBB.1.9.1 is increasing slightly. It is now at 6.5%. Last week it was at 5.1%. And this also varies quite a bit from region to region. But the XBB.1.16 is the one I want to talk about a little bit more today. It's in that purple color to the far left there, and it's the variant that has been nicknamed Acturus. I hope I'm saying that right. It was not shown here at all last week, but I have been mentioning it each week for the past several weeks because the UK Health Security administration noticed that it was on the scene, and it noted that on March 10th. And on March 30th, the World Health Organization classified XBB.1.16 as a variant under monitoring. Remember that variants are not shown on the CDC's tracker until they reach over 1% of specimens. Well, now it is projected to make up 7.2% of specimens. And interestingly, in Region 6, which includes Texas, New Mexico, Oklahoma, Arkansas, and Louisiana, XBB.1.16 is at 21.3%. So that is significantly higher. And we'll continue to monitor whether this impacts cases or hospitalizations as we move forward. But what this brought up for me is the question about how sequencing could maybe be more useful if we had better or more real-time reporting. We see that one region in the United States has triple the amount of a particular variant than the nation overall. I understand not reporting under 1%, but if we're already over 20% in a particular region and don't get at that information until the average is over 1%, there may be a lag time that we could be avoiding. Of course, it won't always be a big issue, but when it is, and some lead time is always best. So the question is, do we have any need to be concerned about Acturus or XBB.1.16? Well, I mentioned earlier when we looked at the world map that India is having one of the largest increases in cases over the last couple of weeks, and we can see that clearly here. And this increase appears to be driven by Acturus. We all probably remember when Delta started in India and then caused a surge in the UK and then in the US, but a lot has changed since Delta. And just because India is having a surge does not mean that we will. But still, this is an important part of our monitoring, seeing to the best of our ability what's happening around the world, learning what we can, and staying vigilant. So what are we learning about Acturus? This preprint comes out of the University of Tokyo, where they've been doing a lot of sequencing of SARS-CoV-2, and they found that XBB.1.16 is about 20% more contagious than XBB.1.5 or XBB.1, suggesting that it will spread worldwide soon. And what they also discovered in their lab is that Acturus got around all of our monoclonal antibodies except sotrovimab. And actually, several of the XBBs do appear susceptible to sotrovimab. Now, remember that all of our monoclonal antibodies were basically pulled off the shelf back in late 2022. So I'd really like to see this reconsidered. I'd like to see sotrovimab come back if possible. With all these shifts in which variant is most popular, I realize this is difficult, but still, it will be nice to see monoclonals come back as an option for treatment or even prevention. So I will definitely be looking out for that, as we do seem to be dealing with mostly the XBBs. And if there is another treatment option, that would be excellent. Acturus does seem to have about the same pathogenicity, meaning it doesn't seem to be making anyone more or less sicker, or increasing or decreasing the risk of hospitalization compared to XBB.1.5. But of course, every time a variant is more contagious, it means more cases, and more cases generally means more hospitalizations and deaths. They tried in the lab to determine why XBB.1.16 is so contagious and how it's getting around our prior immunity, the same way that XBB.1.5 is. And they seem to believe that a mutation that's actually not on the spike protein may be making XBB.1.16 more fit and giving it that faster growth advantage. And one thing that I think is important to note about Acturus is that it has a special new symptom, and this symptom is being reported coming out of India, but since it's on the rise here in the US as well, this is something we need to be alerted to. And this new symptom is itchy eyes, red eyes, and even oozy or sticky eyes. And this is primarily being seen in children. And so this is not great timing because this is also allergy season for us in many parts of the United States. And so you may think that your itchy red eyes are from allergies, but we would not want to just dismiss it as allergies. We want to rule out COVID infection. So new onset of itchy red eyes might not be allergies, might not be pink eye. Consider doing a COVID test if you or especially your child come up with this symptom. And teachers, be alerted to this as well. I know you're already on the lookout for red and oozy eyes, but let's not write this off as allergies. Let's make sure this isn't the highly contagious XBB.1.16. Ideally, we can catch this early and prevent the spread to others. Here in Alameda County, test positivity is at 6.4%. That is an increase. Taking a look at hospitalizations, it's pretty flat. We have 68 people in the hospital, 12 of those in the ICU with COVID-19. And if you take a look, we've placed a line straight across from where we are now. And in looking back, you can see that we have had less people in the hospital many times, at least 5 times during this pandemic. And as I've been reporting for the last few weeks, even though the highs have not been as high, the lows have also not been as low. So this is not a good thing. Our baseline continues to creep up, which is not something we like to see. And this is the case not only here in Alameda County, but statewide and nationwide as well. Overall, in Alameda County so far, there have been 2,229 confirmed deaths. 28% of those are in the city of Oakland. So that's 629 COVID deaths in the city of Oakland. And these are confirmed COVID deaths. And 14% of the total deaths for the county were in the city of Hayward. When you take a look at the cities of Piedmont and Emeryville, they each have had less than 10 deaths this entire pandemic. So this just emphasizes the fact that we know this pandemic has affected different communities very differently. So far in 2023, we've been averaging about 6 deaths per week here in Alameda County. And once again, we know we are in a lull right now in April. And this has been the case every April since the onset of the pandemic. So while we do hope to see this continue to come down, we will need to keep an eye out and we will need to be prepared for a surge, just like we've had every summer since the onset of the pandemic as well. Taking a look at wastewater here in Alameda County, we can see that it is continuing to trend a bit upward. So we'll just be monitoring this to see if it is correlating to increases in cases and hospitalizations over the coming weeks. Now, I know many of us have been hearing lately people saying that they're sick with a respiratory illness that is not to COVID. Well, first, I'll just say, please, can we make sure it's not COVID? One rapid test is not enough to rule out COVID. I know that we've heard that time and time again, but it is true. You need to repeat the rapid test or go get the PCR test, which is more definitive. So get that part done, rule out the COVID, but in some cases, it really might not be COVID. And one respiratory virus that has been on the rise recently is called human metapneumovirus. Human metapneumovirus causes a respiratory illness that looks just like flu or RSV or COVID. And this is the usual time of year for metapneumovirus. We actually had a fair number of metapneumovirus cases last year. And it usually does rise in late winter to early spring, and it typically peaks later than RSV or flu. So this is typical timing for the metapneumovirus. It's just not something that we normally test for. We actually didn't really identify metapneumovirus until about 2 decades ago. So in the scheme of things, it's something that's fairly newly on our radar. But we can see looking at our wastewater here in Oakland that human metapneumovirus is on the rise. And it's also on the rise across the whole nation, and it is resulting in hospitalization, even ICU hospitalization, particularly among little ones. And I linked an article that discusses this in more detail. But the main thing to know is that we want to first rule out COVID, since COVID is considerably more contagious, and we want to prevent COVID from spreading within the household or at work or at school. But in general, we're going to want to treat this like a regular cold with supportive measures. It typically will run its course, but the main populations that We are worried about our babies under 5. This is typically where we see the hospitalizations and sometimes the severe infections, especially if it is coming along with another respiratory condition. And we have seen co-infection with metapneumovirus and COVID at the same time, which can be particularly devastating. We also do get concerned about this among our elders as well. So if you have a respiratory illness, you can go ahead and get tested. Typically, when you get tested, it can be for COVID, RSV, and flu. They can also add that metapneumovirus that we might not always think about it. It's not a very routine lab, but certainly if you're getting a swab that's being sent for a PCR, they actually could do a test for all of these things just so that we know. But really, there's no specific treatment or vaccine for metapneumovirus. And so the most important thing is that, especially in those high-risk groups, so the under 5 as well as over 65, we especially want to rule out things that we can treat like flu or even COVID. And that is particularly for those in high-risk category. So also those with underlying conditions. And remember, if you are over 50 or you have an underlying health condition, you are probably someone who should be treated if you catch COVID. So this is why it's so important to just not assume it's one thing or another, or not to just do one rapid test and be done. If you're someone who should be treated if you catch COVID, if you're someone who should be treated if you catch the flu, then we should be getting tested for those things in a timely manner, because we have a short window of time to start antiviral treatments, and those can be life-saving. And of course, we want you to have a treatment plan with your doctor, particularly for COVID-19. There's still a lot of COVID that is circulating around in our environment, even though we are in a lull. And if you're someone who should be treated, then let's make sure that you have a plan and that you'll be able to access treatment in a timely fashion. If you don't have a primary care provider, please get one. Know how to reach them before you need them. Make a treatment plan. Make sure you're up to date on your boosters. If you did not want the mRNA vaccine, then you can go ahead and get Novavax. It is the more traditional style of protein subunit vaccine. But if you remain unvaccinated, we are especially concerned about you, and know that you are eligible for treatment even if you're under 50 and even if you don't have risk factors. So again, it's really important that you make a treatment plan. This is not a time to be avoiding going to the doctor. We actually want you to have a treatment plan and advocate for yourself, because just because maybe you're 47 years old and maybe you just have mild asthma and maybe you're a former smoker and you're not vaccinated, you are absolutely a candidate for Paxlovid treatment. So this is something that you should be getting. And again, unvaccinated people are actually extremely good candidates for this treatment. It can be life-saving. So in summary, we are currently in a lull with SARS-CoV-2, as we have been essentially every April for the last few years. We can certainly be grateful for this. We can be hopeful, but it doesn't mean that we should let our guard down or forget what we know, because there's still quite a bit of it circulating around, and we would definitely be wise to prepare for increases over the coming months. Even in our lull, we are still losing about 1,500 people per week to SARS-CoV-2 in the United States alone. We're still also losing unexpected numbers of people to heart attacks and strokes, and we know that some percentage of those are post-COVID heart attacks and strokes. We're still learning about this. In fact, we're still learning about all of the effects of COVID infection and COVID reinfection, post-COVID and long COVID. So if you'd like to avoid a potential bad outcome or a potential post-COVID event or potential long COVID effects for yourself and for others, please do what you can to avoid getting infected or getting reinfected or spreading it to others. Gathering outdoors is always safer than indoors. Make an effort to improve your indoor air quality if you must gather indoors. And if you must spend time indoors with others, especially members of the public, wear a high quality filtration mask like an N95, a KN95, or a KF94. Consider using rapid tests for pre-event testing. And if you do get exposed or if you have symptoms, repeat the rapid test every day or two while continuing to wear a filtration mask. And if you or someone you spend time with unmasked would be treated, If you got COVID, then go ahead and get that more definitive PCR test to facilitate timely treatment. Remember, you've only got about 5 days. Please don't show up to work or school feeling sick and exposing others. Stay home and rest. If you have to go out, wear a well-fitted N95 mask as source control. This could keep you from sickening or even killing another person. Don't lose your health benefits at this time. If you receive Medicaid, please update your information so that your state Medicaid office will know how to reach you. Remember that the continuous coverage provision has now ended and the redeterminations have resumed. So people will start losing their Medicaid benefits, and you may have to take some proactive steps to not let that happen. And remember to eat a balanced diet. Let's incorporate some vegetables and some fruit. Let's avoid those sugary drinks. Consider a multivitamin supplement. Get your blood pressure checked. Get those baseline labs checked, like sugar, cholesterol, vitamin D. Get some regular physical activity. Unless you're sick, in that case, we want you to get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thanks so much for joining us. We'll see you again next Tuesday at 10 a.m. See you then.